Hello, my name is Mike Jackson, and I'm the Global Solutions Manager for Healthcare and Life Sciences with Adobe. I'm here in San Francisco at Health 2.0 with Dr. Peter Levin, the Chief Technology Officer of the Veterans Administration. Dr. Levin, thank you for joining me today.
Thank you very much.
Thank you. So I have a couple questions for you. The Blue Button Initiative, would you please explain for our viewers who are not familiar with the Blue Button, what exactly is the Blue Button?
My pleasure. The VA health record infrastructure is comprised of two components. There's the one that everybody knows, it's called VISTA, which is the complete, comprehensive, and clinically valid medical health record. It's what our doctors use to change information between doctors, between clinics and hospitals, and now recently with other healthcare providers.
Right.
Then there's this other component, which is a personal health record. Many people have them. You don't have to be a veteran to have them. But the VA has one of the largest and one of the most popular. It's called My Healthy Vet. Blue Button is a simple download of the My Healthy Vet data. Most of that data is self-entered. Some of it comes from this EHR, comes from Vista. But basically what it is just a flat ASCII file. It's very easy for people to read and very simple for computers to understand.
Okay, and so can you explain a little bit more then about the challenge that was issued both to personal developers as well as industry, the Blue Button Challenge?
Absolutely. Data by itself is not interesting, right? You know, you can have a mountain of data and you don't know what to do with it. You don't know how much energy you're using. You don't know what your grades are in school. You don't know the real estate values where you live until somebody takes and organizes that for you and puts some value-added information analysis tools on top of that. The challenge was to jumpstart all of that for personal health records. Now, Blue Button serves as a catalyst. It's an important catalyst. There are 1 million veterans that are signed up with My Healthy Vet. Already 65,000 of them have downloaded their data even without the availability of these value-added applications. So the kinds of things that Adobe has done and other companies is extraordinarily important to us because all we can do is put this out there in an easy-to-understand, structured way, and then you guys read it and you tell us what you can do with it. You know, we monitor our health on a day-to-day basis, or we're looking for doctors in our zip code, or we have chronic conditions and we'd like to know what the latest research is telling us. That's where you guys come in.
Excellent. That's a great segue because I was just going to inform our viewers that Adobe proudly accepted the winnings, and we were named winners of the 2010 Health 2.0 challenge for the Blue Button Initiative. So I thank you for acknowledging that. And that leads into the next question. What components particularly were you looking for when looking at solutions that really fit the criteria? You know, what aspects were you looking to bring to the end users, and how did the respondents to your challenge address those considerations?
Sure. Well, the response was overwhelming, and it's just like the folks who downloaded, the 60,000 people who downloaded it even before we formally launched the Blue Button initiative today. They're looking for value-added services. So let me give you a couple of examples. You have, say, a diabetic condition. A lot of our veterans are older, and this is something that you're vulnerable to based on demographics, in certain cases based on geographies of service. So you may have a chronic condition like diabetes, and you'd like to be able to manage that better. Well, part of managing that better is to be able to use a glucose meter that is attached to your health record through a Bluetooth device. That doesn't exist today, not yet for Blue Button, but we're getting there. That's one example. Another example I've already mentioned is we're looking for doctors, perhaps even gerontologists, who are focused on curing and maintaining the health of an elderly population that has these kind of chronic conditions. It ends up one of the most important decision criteria is where they are located. So if you can report that your system, and as well as the others, they know how to read, well, geez, so you're taking insulin, you may have a diabetic condition, and here are the things that you need to know, and more importantly, the people you need to talk to be able to maintain your quality of life. That's what we were looking for.
Wow, well, it sounds like it all comes down to the customer experience.
Absolutely.
You're looking to do that. Well, I can tell you, speaking on behalf of Team Adobe, we took the challenge very seriously, and we looked to incorporate 3 basic concepts into developing the solution. We wanted the solution to be intuitive, secure, and interactive. And so I'd like to ask, from your perspective, are there any trends that you see within the Veterans Administration as far as migrating toward a particular technology in enabling your veterans to access and take ownership of their own information.
Well, we certainly want to nourish all of our partners. VA is a big customer of Adobe, as you know. We want to encourage all of our partners to do exactly what you just said. Make the customer experience convenient, do this in a reliable way, do it in a way that they'll find value adding. I would like to also add, we are hoping to be able to do this soon with Adobe and the Blue Button.
Yeah, well, we're gonna keep you posted on that, and we're gonna bring all of our viewers new information regularly on the progress of that initiative. So, Dr. Levin, thank you for your time.
Thank you very much, and congratulations.
Thank you. We look forward to talking again soon.
Okay.
Thank you.